Oh, and welcome everyone. It is 1 p.m. Central, so we will get started. Thank you for tuning in to today's webinar, Teaching Basic Life Support Skills with Hands-on Learning Aids. My name is Kelsey, and I will be your moderator today. First, here is your 30-second introduction to Realityworks for those of you who aren't familiar with us. We are an employee-owned company based in Eau Claire, Wisconsin that creates experiential learning tools for teaching job and life skills. We got our start over 20 years ago when former NASA engineer Rick Germain created the first RealCare baby infant simulator, then went on to found the company that is now Realityworks. Today, our training tools combine curriculum with hands-on learning tools, student activities, and assessments. Baby is still around, but now you can look to us for tools like our bovine birthing and ultrasound simulator, virtual welding simulator, wearable geriatric sensitivity suits, and if you have some time, we encourage you to check out our website and see it all. Presenting today, we have Molly Kellgren. Molly is the Health Science Product Manager here at Realityworks and has been with us for over 2 years. She is a PhD prepared registered nurse with specialized skills in education and the use of simulation as a teaching and learning strategy. She has an in-depth background of health science and simulation, and she is a great resource for today's presentation. Before we get started, I want to cover a couple things. First, today's presentation is being recorded, and all attendees will receive a link containing the recording, as well as a copy of the PowerPoint slides and free resources. For those of you attending live today, you will also receive a certificate of completion for attending today's presentation. Keep an eye on your email. You will receive that email within 24 hours after the presentation, and we will have time at the end for Q&A, so feel free to type your questions in the chat or Q&A feature located at the bottom of your screen. With that being said, I'm going to go ahead and pass things over to Molly.
Thanks, Kelsey. Thanks everyone for joining us today. I know September can be kind of a crazy month for educators, so I appreciate your time. Today, we're just going to talk about some hands-on learning tools that Realityworks has that addresses basic life support skills. Basic life support skills are so necessary for every student to become familiar with, regardless of the particular job role they are most interested in. This is truly a global skill set. So we have a number of products available that address skills needed for basic life support certification. We'll talk through some examples, show some of the lessons or activities that are part of the included curriculum, and talk about ways that the products might be used in your classrooms. So let's talk about our tools. First up is our Adult Nursing Manikin. The Adult Nursing Manikin has the ability to give your students immediate feedback about the quality of their CPR. Both rate and depth of compressions are evaluated against the American Heart Association's recommendations. So if you look next to the left leg of the mannequin in the picture there, you will see the controller box that attaches to the mannequin. So this is the way that students get that feedback in terms of their rate and depth of compression. Of course, this CPR capability is just one of the many skills that can be learned using the Adult Nursing Manikin. Other non-BLS related skills include IV insertion and medication administration, intramuscular injections, urinary catheterization, and more. Here's the list of lessons included in the curriculum that comes with the Adult Nursing Manikin. On the right, you can see an example of one of the student activities that's already been created for you within the curriculum that's provided. Activities and pre and post assessments vary from lesson to lesson and product to product. Sometimes they are hands-on practice, sometimes they're knowledge assessments, sometimes they're skills checkoffs. There's a lot of variety to keep your students engaged. Some activities you might implement in your classroom using the Adult Nursing Manikin could incorporate skill stations for your adult patient unit. You could have stations using other equipment you already have. For example, one station with task trainers for catheterization for both male and female. One station could be all about medication administration, like preparing an injection, including some math to prepare the correct dose, and then practicing technique with injection pads. And of course, another station could be using the Adult Nursing Manikin for CPR practice. Next up is our Pediatric Nursing Manikin. This mannequin also gives students the opportunity to practice their CPR techniques and to receive feedback about the rate and depth of compressions. Since the actual technique is different between adults and children of this size, it is so important to allow students a safe place in the classroom to become confident and competent in their CPR skills. Similar to the Adult Nursing Manikin, there are many other skills students can practice on the Pediatric Nursing Manikin, including catheterization on both boys and girls. The mannequin also comes with a separate IV arm for insertion practice, medication administration practice, and phlebotomy. Here is a list of lessons included in the curriculum that comes with the Pediatric Nursing Manikin. On the right, you can see an example of one of the quizzes that's part of this particular product's curriculum. Again, there is a ton of variety in the components of the curriculum. Some activities you might implement in your classroom using the Pediatric Nursing Manikin could include activities that can be done with the different components of this mannequin. First, the first station could be the actual CPR station with the mannequin itself. You could have a second station where students practice IV starts with the separate IV arm that's provided. There could be a third station where they practice preparing for medication administration, including math for pediatric dosage calculation. We understand that the skills involved are very similar between the adult mannequin and the pediatric mannequin, but pediatrics can be very intimidating for students to address. So giving them that safe space to practice until they feel confident and competent is very important. Next up is our infant CPR mannequin. This mannequin is a great resource for helping students learn correct technique for CPR and proper head tilt and chin lift. Face shields are also included to keep things clean between students when practicing giving breaths. This particular mannequin is a no technology product, so it's easy to maintain in your classroom and you don't have to worry about things being plugged in or charged. It's a nice, reasonably priced mannequin to incorporate. Again, the use of having a baby in the classroom is really wonderful to get students used to to get your students used to taking care of this age of patient population. Here's a list of lessons included in the curriculum that comes with the infant CPR mannequin. You can see that it's very straightforward and really concentrates solely on learning good CPR technique. It's so common for people to panic when it comes to helping babies in situations like this. So giving your students the opportunity to practice over and over again will help them if an emergent situation happens in real life. On the right, you can see an example of part of the lesson about actually learning CPR for infants. You can see the specificity of the information given, so students will have all the information they need to learn this overwhelming skill. This is the third product that I'm presenting that aids in the teaching of CPR. Research is showing that repeated practice performed often is the most effective way to keep skills in CPR. One way to provide that repeated practice for your students would be to not limit CPR exposure to the first time they're learning it. For example, in your adult unit, students learn CPR on the Adult Nursing Manikin. Maybe when you're in the pediatric unit, you have two CPR stations, one for adult and one for the 3-year-old child. This way, students will have the opportunity to see the differences in technique side by side, along with getting another opportunity to practice adult CPR. Now, in your infant unit, the same thing can happen. Bring all our 3 trainers to highlight differences and similarities in technique, as well as giving more and more opportunities to practice CPR skills. Next is our choking baby. Our choking baby trainer is a great option for an entry-level learning opportunity for everyone. from those who are exploring different career opportunities, future childcare workers, nursing, or medical assistants, even for community education. This is a simple tool to help learners get the basics on how to handle choking emergencies and to learn the techniques for intervening in those scary situations. Here's a list of lessons included in the curriculum that comes with the choking baby. This is another no technology trainer that just focuses on the prevention of choking and the actual handling of a choking emergency. On the right, you can see an example of an engaging activity that students can do to learn about objects that are risky to have around infants. This product can be another station added to your others to give students the opportunity to learn how to handle not just CPR, but to handle other types of emergencies like choking. Next is our bag valve mask trainer. Our trainer gives you and your students the opportunity to learn both 1- and 2-person techniques when it comes to using a bag valve mask, as well as performing CPR. The electronic controller gives immediate feedback about the rate and volume of breaths, as well as rate and depth of compressions, according to the American Heart Association guidelines. Here's a list of lessons included in the curriculum that comes with the BVM ventilation trainer. The electronic controller that I mentioned is a great tool that allows your students to practice independently and get much needed feedback about their performance without being completely reliant on you for that feedback. It really frees up your time to focus on other groups of students. On the right, you can see an example of a student skill checkoff form. This is another type of resource you will find often in the curricula we provide with products. Use this form to give students autonomy when practicing their skills in pairs or groups. They can practice skills, and others in their group can practice evaluation and giving productive feedback to their peers. So you can see that Realityworks has a wide variety of products available along with their curriculum to help you address your BLS needs in your classroom. Please feel free to reach out to us if you have questions about any of these or other products that we have in our repertoire. With that, I'm going to pass it back to Kelsey now for any questions that may have come up.
Perfect. Thank you, Molly. Just one question here. Who are these trainers geared towards as far as grade level?
You know, basic life support is, like I mentioned before, a very global sort of skill. And the way it's written is really can address a wide variety of ages. I would start maybe late middle school into high school, and definitely any of those post-secondary courses that are specific to healthcare providers or any community participants who would like to learn the skill of BLS.
Perfect. Awesome. All right. Well, I think that is all the questions that I'm seeing at this time then.
Great. Nice, short and sweet today. So appreciate your time, everybody. Have a great rest of your day.